the support staff, the hygienist, there is formal education all the way up the line. So the, the student that's interested in dentistry doesn't necessarily mean they're going to be a dentist.
And some of the support staff might not be in your office. I mean, I have dental technicians who are the artists, the real artists making the porcelain crowns, making the implant crowns, who that's a wonderful field.
That's
if
another
you're,
location.
Yes.
That's a lab that's
right.
That's
well, sometimes
doing,
it could be on location, but very rarely.
Yeah, the casting.
Right, casting the metal, whatever it is. So that's a true art.
Just want to stop for a second. So you guys okay here? Any general questions yet? Anybody yet? Keep thinking. Yeah, okay, all right. Just want to make sure you're still part of this. I just want to make sure. All right, careers in dentistry. We've pointed out the fact that everybody has to go to school. All right, everybody has to go to school. Should a student, what if, crazy question, but I can't stand the sight of blood. But you know what, I want to do this. I want to, you know, how do you overcome that?
I think that there are a lot of orthodontists who don't like anything messy, and their work is pretty much clean and dry and bloodless. Yeah, so there are specialties that you can choose that minimize.
So why the different specialties? Why aren't they all general dentists? Okay, is it just a matter of this is what I want to do? I can reconstruct. You know, I can reconstruct someone's face to make it look good. I mean, we know that there are children that they were born with disfigurements and or through accidents and so forth. That's one profession that does that.
I think that there are always the complicated and advanced cases which are best served by someone who just does that. The same thing in medicine. Although there are internists, they know that there are times they have to refer out to the cardiologist. The internist may feel comfortable giving blood pressure medication, but then if they think it's more than that, they have to refer to the cardiologist. They may feel comfortable giving an antibiotic for a respiratory tract infection, but if it gets severe, they may feel that they need a pulmonary doctor. So it's the same idea.
So you mentioned before that the technology is important, that the technology certainly has evolved over the years. Let's talk about that for a moment.
Well, you spoke about making the experience painless or comfortable, really, you know, and I think the dentistry's come a very long way. Some patients don't like impression material, you know, shoving something in your mouth, you know, it's not really comfortable. But now the newer technologies are coming out with digital impressions, where you spray a little powder on the tooth, you take a picture, and it's on the computer screen, and a computer-aided design, almost a robot, can make you a crown. So talk about time-consuming, I mean, one visit, comfort, quick, you know.
Talking about a 3D printer?
Not a printer, but a program. You can take a picture of a tooth that was prepared by us, and that will get sent to a computer.
That sees it three-dimensionally.
Three-dimensionally, and a computer-aided almost robot can make the crown chairside.
Okay, so the only way I can relate to that
Something we have at Tech.
This is like this is the Jetsons, you know.
You know, here at Staten Technical High School, in the AutoCAD, we design in 3D, build up. But we have something called a 3D printer, and what happens is you take a solid image, and the solid image is captured as an STL, okay, and that STL is used in this 3D printer. And what it's done, it's almost like an MRI scan, where it builds the item up layer by layer. And there are a number of 3D printers on the market.
And what do you get from your printer?
You get a solid model that I use in class to hold up and say, let's take a look at this.
Yeah.
And one of the examples that I use is, let's say the museum here in Manhattan has a bone that is needed somewhere else in another museum. We have it. They scan this in a 3D scanner, and they duplicate the bone and ship it to connect to another.
That's amazing.
So similar.
Yeah, similar.
Okay. Recently, I've been going to the dentist. Okay, obviously. So recently, different technology is that, and they take the X-ray and it comes up right on the screen.
Yeah.
Right.
Another little device that's
around,
that. So I didn't know about that. That's pretty
Yeah,
cool.
that's you got inside info. Okay.
That's pretty cool. That's nice. So what other technologies exist to help them benefit the patient in terms of pain, to help the benefit, the patient in terms of creating, the bridge and so forth.
Well, the materials are just getting better, stronger. The porcelains today are getting much stronger. There was great interest in all porcelain caps. Starting, I don't know, maybe 15 years ago, and through trial and error, some were strong, some weren't strong enough, but the new materials now, every 6 months, are coming out with materials that are stronger and stronger. So that kind of technology. Technology with the Invisalign, that's another whole technology-driven subject.
Yeah, instead of uncomfortable braces, metal braces,
Yes.
now it's a comfortable, easy to wear, clear aligner.
And that is computer generated.
And that's computer generated as well. And also the dental experience is getting better. It's not just, drill and noise.
Yeah, there's a
and
philosophy here. There's a,
but
when I
just-
think of a dentist, I think most people would think pain.
yeah,
Oh,
but that's, see, we're
That's
trying to
changing now.
eradicate
Yes.
that.
Yeah.
And as time goes on, whether it's earphones so you can listen to music, your own iPod, whether it's you're wearing glasses and you can watch a movie or whatever it is to make the whole experience better for you, that's all on the table. And I think it's, as the years go on, it's not the whole horrible experience that we think.
What would you say then to students who have an interest in dentistry? How do you begin? They're all going to go. I mean, everyone in the school graduates, goes on to college, definitely. Okay, and they go on to great colleges, in fact. All right.
My strong feeling is at this point, while you're still in high school, if it's not feasible for you to get a part-time job in your dental office, ask your dentist if you can shadow them 1 or 2 days. We always welcome young people to do that. We ask the patient in the chair, would you mind if so-and-so looks over our shoulder? And the patients, for the most part, don't mind. And you really need to do that to see if this is something that you want to do. I was really so lucky to have that experience working at 16 for my family dentist. It never would have entered my mind. But even just shadowing a dentist for a day or two, it motivated me through college. I went to St. John's University in Queens, and I was really motivated because I wanted dental school. So it was easy for me to decide on Friday night that I was going to stay in and study instead of going out with my friends, because I knew what I wanted. And if I did not go into college with a very clear motivation, I think it would have been harder to apply myself. So it starts in high school.
Yeah, she's absolutely right. Just having that focus. And I had the same experience. I mean, I didn't work for a dentist, but like she said, I shadowed, and but I also volunteered in the hospital, and I also worked for a physical therapist, and so I kind of eliminated anything that I didn't want to do, and I found dentistry, and I said, you know what, this is what I want to do. And once I had that focus, and it was actually my first year of college, so you don't have to do it in high school. It could be a little bit later on too. Once I had that focus, it was
How
easy.
difficult is it to get into a dental school, and how expensive?
It's very expensive, and it is difficult. As the years go on, it's getting more and more difficult. But you apply yourself, you get good grades in college, and you have some volunteering experience. It's the gates are open.
Shelley, how many students in the pre-med club are thinking about? Well, they're all thinking about medicine of some sort, but how many understand the fact that maybe they should call a doctor or go visit someplace? I mean, do they have that?
I think a lot of us are more medically aware of what's going on rather than other students in our school who are not interested in medicine. So I think that having these kind of discussions with different doctors is something that's really valuable to us, and learning what kind of things we can do and learning from your experiences. I wasn't interested in dentistry. I was more, maybe a surgeon, maybe a pediatrician, but dentistry is something I may be looking into. So it just gives us an idea of what's out there, what kind of different fields are available for us.
So there are about 30 students, I understand.
There
in
are about
pre-med?
30 students here.
So if we multiply that by every high school in Staten Island, would you say that perhaps in the borough of Staten Island it could be like 200, 300 students interested in medicine?
Absolutely.
At least, yeah.
So I think that something that you said, so for what I guess we can reiterate, is that we should definitely start now with contacting different doctors and volunteering with them and doing the best we can in high school for college.
Yeah, seeing at the very least, what you like, what you don't like. You might not like working with your hands. You might not like kids, like, you know, pediatrics or whatever it is. And then once you find that, and take it from there.
So take us through, we'll start with you because you're the youngest one here anyway,
Yeah.
except for Shelley, of course. You graduated dental school.
Yeah.
What goes on from that point?
Well, I did a 1-year residency in a hospital. Now, when I graduated about almost 9 years ago, that wasn't something that you had to do. You didn't have to do a
Now
residency.
you have to.
Now you have to. Okay. So, which was great for me because I got a lot of experience in that residency.
Working in the clinic.
Working in a hospital setting, but
Right.
just seeing a lot of patients just practice, like you said before, just doing it and doing it. And after I did that, actually, in the middle of that 1-year residency, I started working for Dr. Nasso and Dr. Olsen. I can't believe that was almost 8 years ago, and time has flied by. And,
The experience at the hospital level, that's a supervised experience. Then I would take it, right?
Oh, yes.
You-
Yeah,
right,
sure.
So, and the person that you're working under is naturally sharing information with you, guiding you along.
Sure.
And you're picking up things that because of his experience.
Sure,
in
especially
carrying it with
especially right out of dental school, you
Yeah.
have an attending there who's guiding you through the
you.
process.
So were you nervous the first time around?
Yeah, sorta. Yeah, sort
I
of.
can't
At
even
least the
know.
first couple of months.
Yeah.
But as time goes on, and the more practice you get.
We got a couple of minutes. What do you like? What part of your day in the job that you do you like the most?
Well, that's a good question, Frank. I think what I like the most about what I do during the day, we probably all get this feeling throughout the day, is somebody comes to you in pain or somebody comes to you with an issue and you solve it right there. Whether it's getting them out of pain, fixing that broken tooth, or making their smile better in one visit is really the best part of that day. And we always look for that feeling as the week goes on, as the month goes on.
You have to take something out of the job. I'm teaching 38 years. It's got to, I've got to feel good about the job.
Sure.
Obviously, I'm in it this long. But, if one student says to me, thank you, that's enough.
Yeah.
Do you get that?
Sure. Yeah.
What's your day like? What's the best part of
Yeah.
the day for you?
Exactly what Ron said, and that's why I'm so pleased that I chose a career in dentistry, because you can, in 20 minutes, in an hour, really make a difference in someone's life. You can fix a broken tooth, you can take them out of pain, and that's just a wonderful privilege to be able to help people so directly.
We're about running out of time. I want to thank both of you for joining me this evening, and Shelley, thank you for being here as well, and the Pre-Med Club members. I hope it was educational for you. This is Frank Mazza saying good night, and be sure to keep in focus.